Hello friends, I'm Dr. Manish Bhatia, your friend and your autism guide. Today we are going to discuss the question whether autism spectrum disorder is hereditary or genetic. A very common question that I receive from parents of my patients is that what is the probability of their second child getting autism? Is autism hereditary? How likely, what is the likelihood that the second child will also be autistic? Till now, the cause was not very clear. We knew that there were certain hereditary factors, both genetic and epigenetic, that were responsible for development of autism, and at the same time there were many environmental factors also. A recent study which was published as recently as in July 2019, it's a large-scale study, has demonstrated that nearly 80% children can be attributed to have some genetic predisposition, some genetic cause which predisposes them to develop autism. So yes, autism spectrum disorder is hereditary or genetic in large majority of cases. Only in 20% cases now it is believed to have some kind of environmental influence responsible for development of autism. But for a majority of children, yes, there is an element of genetics involved in the development of autism. Now, what genes are involved, it's still a work in progress. As of now, we have been able to identify nearly 100 genes which are likely involved in the development of autism spectrum disorder, and there's going to be much more research to filter out the more likely, more probable causes of this genetic predisposition. So the next question that comes to us is, what is the likelihood, what is the probability that the second child is going to be autistic? Well, the answer that we get is through studies of siblings. What is the existing data that we have? In cases of siblings, the first data that we have is studies done on identical twins. In cases of identical twins, it has been found that the probability of second child having autism varies from 36 to 90%. If one child is autistic, there's a huge chance that the second identical twin, is also going to have autism or some kind of learning disability. So the current data that we have regarding siblings, I'll read it out for you. When the oldest sibling diagnosed with autism spectrum was male, 4.2% of female siblings and 12.9% of male siblings were also diagnosed with autism. So if the elder child is male, then it is 4.2% of the female child which comes next is usually autistic, and nearly 13% of the male sibling who is born next is found to be autistic. But if the older female sibling is diagnosed with autism, then 7.6% of the younger female sibling and 16.7% of male siblings are also diagnosed with autism. So what we can see is that whether it is a male child who is elder and is autistic, or it is female child who is elder and autistic, in both cases, if the second child is male, he is more likely to be autistic, and the variation can be from 8 to 16%. If the second child is female, the variation can be 4 to 8% approximately. So this is the data that we have. As of now, we know that if the elder child is autistic, there is a fair chance that a second child can be autistic. The percentage can vary from 4% to 18% depending upon the gender of the second child and the gender of the first child. So this is the data that we have. So we know that there is some probability that if your first child is autistic, then the second child can be autistic or can have some form of mental disability. But we are we do know for sure that that probability is less than 20% in all cases. So there are 80% chances that your second child will not be autistic. So this is all the information that we have today regarding whether autism is hereditary or not. I hope you have found this information useful. If you have any more questions regarding autism, its diagnosis, its treatment, please visit drbhatia.com and you can post your queries there. I'll be able to help you in any way possible. Thank you so much.